Respiratory syncytial virus by Liam and Dream. Respiratory syncytial virus is found on the tissues in the lungs on the apical layer of the cilia epithelium. Patients will experience shortness of breath, wheezing, and coughing. Individuals who acquire severe cases of RSV will lead to bronchitis pneumoniae, asthma, chronic obstructive pulmonary disease, and congestive heart failure. Patients will commonly experience cold flu-like symptoms and are required or advised to reduce the contact with others 3 to 4 days. Usually RSV in certain patients will last to 1 to 2 weeks depending on the severity. The taxonomy of RSV belongs to the large family of the Pneumoviridae, and the family is further classified under orthopneumovirus and metapneumovirus. The morphology of RSV. They are single-stranded negative sense RNA viruses, which do not allow for the reassortment of genes. RSV has two unique external glycoproteins. One is referred to as the fusion protein, F protein, and the attachment glycoprotein, G protein, which helps conduct counterbalance for the antibody response. These fusion proteins, which are uniquely found on the cell membranes of RSV, are able to function at physiological pH, which is an important factor to the reason why they are able to fuse with other cells, resulting in syncytia, which is referred to as a large cell that contains several nuclei. Reservoir and environment. Humans are referred to as the primary reservoir for RSV. Individuals who are immunocompromised or have medical ailments will be more susceptible to acquiring and experience much more negative effects of RSV. Infants who are exposed to cigarette smoke and polluted air will increase their severity of RSV virus and make them more susceptible to acquiring this disease. People will always be regularly affected with RSV through the course of their life, but as they become reinfected, the symptoms will lessen in severity due to their body's capability of having an immune production regarding for that virus. People will continue to be able to pass on RSV to other individuals, which is why this virus will reinfect. Where does RSV occur? RSV occurs in 20% of the Black population compared to a zip code with a 5% Black population. RSV cases are located in a county known as New Haven, and where about 95% of them are positive compared to other countries. Cities that are more densely populated, known as urban cities, compared to rural cities, will have higher cases and rates of infection for RSV. Climates of tropical with lower temperatures and higher precipitation will always have a constant rate of RSV infections per year. Pathogenicity. Children who are under the age of 5 with RSV will be estimated around 100 to 500 deaths per year. Adults with RSV will estimate around 14,000 deaths occur annually. RSV is known to be a true pathogen due to its high infectivity. The reproductive ratio of RSV is estimated around a 3.0, and the duration of RSV is commonly around 6 days. Transmission. RSV is commonly transferred by the humoral methods of coughing, sneezing, any routes through the mouth, nose, or eyes, which is why people will instruct you to cover your mouth with your elbow while you cough in order to resist the spread. RSV can survive on surface for several hours. People who are at risk of RSV are children under the age of 2 and elderly adults. More commonly, the reason why it's children under the age of 2 is because their immunity isn't able to protect themselves. It's not fully matured in a way to protect themselves from acquiring the disease. Signs and symptoms. Common symptoms of RSV is the cold and flu symptoms of fever, sneezing, coughing. However, the major symptom that differentiates of RSV is the croup barking cough. Symptoms that infants will experience would be, pausing of breath, decreased activity, fussiness, decreased appetite. However, the severest symptoms of RSV in infants would be shortness of breath, weaving, lips turning blue. Elderly adults who have RSV will acquire bronchitis, pneumonia, asthma, obstructive pulmonary disease, and congestive heart failure. Diagnosing RSV, medical officials will commonly, of course, look through their medical records. They will measure their oxygen levels, especially due to this being a lung virus. They will order white blood cell counts to measure the level of the infection and to use an X-ray to visualize the severity. Most commonly, RSV is tested through the nasal swabs and if the patient has RSV. Specificity is 80% and the sensitivity is 97%. The common routes of treatment for RSV, there is really no vaccine created to treat this yet. However, patients who are in the hospital can be put on ventilators and respirators to receive their adequate levels of oxygen. And infants who are at high risk, such as immunodeficient or they were born with lung disorders, can receive monthly palivizumab injections. There are, of course, home remedies such as humidifiers, increasing your fluid intake, and steam saunas, anything to really help aid in infections of the lungs. The control and prevention. The major thing is to educate future parents and caregivers of RSV and the precautions needed to take. Sanitation protocols would be proper hand washing, cleaning methods, and etc. Smoking is a major concern for RSV and the reasons of acquiring it. So it is required, the best is to not smoke. Breastfeeding, of course, is the #1 way for infants to receive their antibodies for RSV until their body is able to create a stronger immune response. Daycare facilities, along with gyms, have higher levels of receiving the infection, so it's best to reduce the time spent there. And ICUs will take precautions when treating patients, so of course maintaining 3 feet apart, covering your mouth, wearing N95 masks, wearing gloves and gowns to prevent humoral transmission of infected patients, and of course limiting the transfer of patients to different rooms. Trying to place only single patients will help with the high airborne infection rate of RSV. And that is it on RSV virus. Thank you.